The mission of the Outer Banks Hospital is to enhance the quality of life for the residents and visitors of Dare County and the surrounding region by promoting wellness and providing the highest quality health care services. Thank you for allowing us to care for you and to coach you toward wellness.
Lung cancer is the leading cause of cancer-related deaths in the United States, and in Dare County, lung cancer is our most common cancer type that we're seeing right now. Even higher incidence than breast cancer and prostate cancer, some of the ones that historically we have seen as the most common cancers. Now lung cancer rates are beating those two. So here at the Outer Banks Hospital we have the Development Council, and that group of men and women have been very effective in fundraising, and they have earmarked funds to support lung cancer screening for patients who meet criteria who don't have insurance. It is a non-invasive test. It doesn't require any medications or any needles or anything like that instilled in your body. The lung cancer screens are low-dose CT scans, which means that they administer the lowest amount of radiation necessary to get an effective test.
Lung cancer screening is so important. The majority of lung cancer is diagnosed at stage 3 or 4, and the problem with it is you usually don't see any symptoms. It's asymptomatic until it's too late, and it's just at that point more of a controlling and trying to maintain it, but it's not curative. The beauty of this screening is that so often, even though you're not symptomatic but you're high risk, you can now get screened and find the nodule or the cancer early, and we're able to plug you into a system where you can have it resected, you have the surgery, you have follow-up, and it's saving lives every day.
A year ago, I lost one of my closest women friends to lung cancer, and it was totally unexpected. And if she had availed herself of this low-dose CAT scan lung cancer screening, she'd have had options that she didn't have. It's largely because of all the advances that we have in treating this kind of cancer. So I looked into this, and I had no idea that lung cancer has the highest mortality of any cancers here in Dare County. So this is really important to our community. So for me, it became very important and very personal. And when I went for my annual physical, I mentioned this to Dr. Metcalf. I met all of the screening criteria, and so he was wonderful, and he jumped right on it. And the hospital called me very quickly. They were able to set up appointments, and I was in and out in 35 minutes with really great staff.
The criteria for this screening program is for any patient that has a smoking history of 30-pack plus years or 2 packs a day for 15 years. They're either a current smoker or have quit within the last 15 years, and their age is 55 to 80. The patient would also be asymptomatic because it is a screening. And then the way it would begin is we would get an order from their primary care physician. They would send it over to the hospital. We would schedule the screening. If they do not have a primary care physician but are interested and know that they do meet these criteria, they could just call us at the nurse navigator office, and we would be more than happy to help them get plugged into a primary care physician that could assist them with this.
A lot of these people worry about, I do smoke or I did smoke, and do I have cancer lying in there that I just have no way of seeing, and I think it really can take that worry off their mind a lot, and I think it can be a huge positive in their life if they come back and have a negative test. Just one less thing that they have to worry about at this point in their life.
Now, I had a positive outcome, and I'm glad for that. And we're going to keep monitoring because of my smoking history, and I'm very glad for that, so that I'll have options that my friend Jane didn't have. And I want everybody in this community to go to their provider and ask for the screening program so that if something is found, everybody will have the options too. That's really important to me.